Assalamu alaikum dear students, welcome to the second part of our pedigree drawing talk. You can see here the table indicating the symbols for our pedigree drawing. You can see that the unaffected persons are mentioned with the unfilled squares, circles or diamonds, whereas the person affected with the trait are shown with the filled circle, squares and diamonds. You can also see that those who are carrier for the trait but do not show it, they are termed obligate carriers here, and we use this term for the autosomal recessive pedigrees, and they are mentioned by putting a dot in between square, circle or diamond. If you want to show an asymptomatic carrier that the person is unaffected at this time of the pedigree drawing, but it might later exhibit the trait, as in case of the progressive disorder. So for that cases, we can put a line splitting the circle, square or the diamond in half, and it we can also fill them half. We can half fill them, indicating that they are the asymptomatic carrier. Then, if the pedigree is getting very big because of the number of the offsprings for that particular family, what we can do, we can actually collect people who are asymptomatic together. Like if we have five brothers who are not exhibiting the trait and they are present in a sequence, in the consecutive sequence, then we can put a square and we can write number 5 within it, indicating that there were five brothers or five siblings, male siblings here, and that will shorten the overall size of the pedigree for you. The same we can apply for sisters or for the individuals with the unknown sex or undeclared sex. And for the person who had died, we can put a slanting line. Then the proband is mentioned by a small arrow underneath. You can also put a small p against it, indicating that it is the proband or the index patient. And we use the term propositor for the females and propositus for the male. But it is getting obsolete and we don't use it that often anymore. And if we don't know the particular person's family history, whether he was affected or the normal, then we can put a small question mark within a circle, square, or diamond, indicating the missing information. Then the parents, I have told you already, the parents are shown by drawing a horizontal line between the two, indicating that they were in relation, they were the spouse, and then we can draw the siblings, their offsprings, by putting a vertical line and again a horizontal line to mention the number of offsprings. And the offsprings are siblings to each other, and that's it. If we have to indicate adoption, then we will put a bracket around the person who was adopted, and we will draw a solid line that will denotes the biological parents, and indeed we have to mention the biological parents as well in that pedigree. Then the twins, if they are monozygotic twins, then we will put a small line, vertical line, and then we will split it where then we will they show the branching, and that will be indicative of the fact that they started their journey as a single zygote. They were the digametic single zygote, but later they split to form two identical monozygotic twins. And I have already told you about the dizygotic twins, that you will start their branching from the very beginning. And for consanguineous mating, we will draw double line. Look at this pedigree. You can see the Roman numbers on the extreme left side of the pedigree. They indicate generations. So the eldest generation will be termed 1, and the most recent one will be mentioned with the number corresponding, which will be the most recent one. For this pedigree, the fourth generation is the most recent one. And you can also see the field symbols, the unfilled symbols. And if I've asked you how many are affected members in this pedigree, you will simply count the filled circles and squares. Like here, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. 11 persons are affected for this pedigree.
Okay.